Hello, everyone. My name is Viviana Haskell, and I am a registered nurse working at UCSD Medical Center, Hillcrest, and I work at a cardiac medical step-down unit, 10 East. I'm here to discuss an important issue we face in our unit, workplace violence. As nurses, we provide care during some of our patients' most challenging moments, but unfortunately, aggression towards staff has become a daily reality. My mentor, Stephanie, and I felt compelled to implement meaningful interventions supported by reliable data. We embarked on this journey together on a project called Shedding Light, Uncovering the Shadow of Workplace Violence. Our project targets the underreporting of workplace violence. We noticed a significant gap between the incidents reported through our official system, iReport, and the calls made to security. Security calls made were significantly higher than report submissions. This discrepancy highlighted the severity of underreporting. Discussions with nursing staff revealed barriers such as a lack of awareness about how and when to report incidents, confusion regarding the reporting process, and time constraints. This underreporting reflects a disconnect between leadership and the realities that nursing staff face daily. To address this, we formulated our clinical question. For nursing and nursing assistants working on an inpatient step-down unit, how does the implementation of a multimodal workplace violence education program designed to bring awareness and eliminate barriers to reporting, compared to current practice, affect the accuracy and efficiency of reported workplace violence incidents? We then began our research and literature review. 9 articles were reviewed, but only 7 articles were utilized. We drew insights from the Aggressive Incidents in Medical Settings study, also known as AIMS, which helped guide our interventions. Stephanie and I had several Zoom meetings with the author of the study, Dr. Yiniko, to discuss workplace violence and barriers contributing to underreporting. Some of the key findings we found was that aggressive events occur on a daily basis. They negatively impact the mental health of healthcare workers and patient safety. Event counters and AIMS logs offer greater information about patterns of aggression and preventative interventions used, and provide information on the need for debriefing and worker support after aggressive events. This is the timeline of the project. We initiated this project in April by presenting at the Unit-Based Practice Council of 10 East to gain support. In May, we held one-on-one meetings with staff to assess their knowledge and barriers regarding workplace violence reporting. In June, we started education on AIMS study implementation and workplace violence awareness. We selected champions to educate staff on the AIMS study implementation. In July, the AIMS study implementation was in full force. We implemented the AIMS log as a data collection tool using clickers to track aggressive events in real time. Staff then documented incidents in the AIMS log, which took just 1 to 3 minutes to complete, while also encouraged to use the iReport system. In August, we analyzed the AIMS log data to develop an educational program focused on raising awareness and addressing barriers. In September, we re-educated staff on iReport using a multimodal approach. This included video, print, and in-person education. A QR code was created and included a quick video guide on how to report workplace violence in 5 minutes or less. By October, we introduced an Epic Smart Phrase to streamline documentation called .aggression report. Looking ahead to November, we plan to send out a retrospective survey to gauge staff confidence and attitudes on workplace violence reporting. Now to results. This graph represents the number of iReports submitted in 6 months before and after the project interventions. From September of 2023 to March of 2024, the 6 months prior to the project, a total of 8 iReports were submitted. That is represented by the purple line. During the project implementation period from April to September of 2024, 33 iReports were submitted. That is represented by the blue line. The average number of iReports submitted over this 12-month period was 3.4 per month. Throughout the project, we successfully increased reporting above the standard mean, represented by the black line across the graph. The star highlights the exceptionally high value of 10 reports submitted during the month of July. This was also during the AIMS phase, which 10 iReports were submitted in a 2-week period. We were able to get amazing results, with a whopping 312.5% increase in iReports compared to 6 months prior. During the AIM phase, we were able to calculate exposure rates. We found out that nursing staff is exposed to at least 1 aggressive event for every 40 hours worked. The aggression rate for the unit is projected to be 1,138 aggressive events per year. As I look ahead, I plan to collaborate with workplace violence managers to streamline the reporting process, ensuring continuous monitoring and education. My goal is to expand this initiative to other units and to present at conferences. I plan to conduct retrospective surveys to assess staff confidence and attitudes towards workplace violence and reporting. Let's address the elephant in the room, but we cannot do it blindly. We need data to understand the intricacies of workplace violence. Addressing underreporting requires raising awareness, improving the reporting system, and fostering open communication between leadership and staff. These are the references I used, and I want to thank you for listening to my presentation. If you have any questions, please don't hesitate to reach out to myself or Stephanie. Our information is provided below.